Well, it is National Kidney Month, a time to think about our alcohol intake and take care of our kidneys. Dr. David Persse, Chief Medical Officer for the City of Houston, is joining me to offer advice on how Houstonians can consider our kidneys. Good morning, Dr. Persse.
Hey, good morning, Haley. Good to see you.
Good to see you too. So why is it important to take care of our kidneys?
Well, kidneys are really important for our overall health. So I think everybody knows that kidneys, they filter our blood and they take all the excess water out of our blood, and that's what helps create urine. But also that urine is yellow because there's other things in there that the kidneys get. So they get a lot of waste, a lot of nitrogen waste in particular, and muscle waste and other acids. But it's also really important in balancing things like your sodium levels, our calcium, phosphorus, and other minerals that are really important to health elsewhere in your body. And then the other thing that the kidneys do that most people don't know is it's really important in regulating certain hormones. And those hormones have a lot to do with our blood pressure, also developing new red blood cells, and again, back to the calcium, the phosphorus, and making sure your bone health. So it's not just about getting rid of excess water, it's about maintaining health and other things as well. When your kidneys begin to fail, you're going to notice what you would expect for certain the symptoms, right? You're not going to be excreting that water as much, so it's going to accumulate in your body. Gravity is going to pull that down. Your feet are going to get puffy, then your ankles and your lower legs. But what people don't often think about is that it will also accumulate in your lungs, and you'll start having difficulty breathing, particularly at night. And then in addition, you can get really itchy skin. You're going to get muscle cramps and just feeling lousy overall. So there are some rather vague symptoms to keep up with, and if you start experiencing those, you need to talk to your doctor.
Yeah, symptoms in other parts of your body that you wouldn't really necessarily associate with the kidneys. What are some of the things that negatively affect our kidneys? I heard you mention sodium, so I guess you're going to mention diet.
Well, absolutely. So diet is really, really important. We talk about, so healthy kidneys can handle a regular amount of sodium in your diet, which would be salt based, right? But if you've got kidney illness, your doctor is going to, really, really strengthen your importance of maintaining the right salt values. And so again, you and your doctor, you're going to talk about how much salt should be in your diet. For those of us who don't have kidney disease, you still want to keep your salt intake kind of, not excessive. And the problem is that so many of our foods have added sodium that you don't even recognize. So you do need to pay attention to it, even if your kidneys are healthy. The other thing, and you mentioned this, is alcohol. And people don't think about this, but alcohol will stimulate your kidneys, and in the beginning, you're going to urinate a lot from the alcohol, just stimulating your kidneys. But then what it does, that makes your blood thicker, which makes it more difficult for your kidneys to do the job that they're intended to do. So in a little bit of a complex way, just drinking too much on a Friday night can impact your kidneys. Now, if you drink a lot on a regularly long basis, if you're a heavy drinker, that makes it even more complicated, because your kidney and your kidneys and your liver, they actually work in concert with each other. And as the alcohol starts interfering with your liver's ability, that's going to roll over into causing more problems for your kidneys too. So again, a little bit of alcohol might be okay. A lot of alcohol, either in a binge or long term, is going to cause problems for your livers and your kidneys. In addition, smoking is pretty much bad for every organ. And the kidney is no different. Remember, the kidney gets rid of a lot of the toxins in your body, and smoke is loaded with toxins. Yeah. So those are a couple of the things you want to pay attention to.
Well, what's going to happen if you are somebody who long-term neglects the health of your kidneys?
Well, long-term kidney issues, as I said, you're going to wind up with fluid retention. That's going to impact, the fluid will wind up backing up into your lungs. You're going to have difficulty breathing. That's going to also put a big strain on your heart, because your kidneys are not getting rid of that water like they should. Now your blood volume, instead of it being, I talked about your blood getting a little thick from the alcohol. When your kidneys fail, your blood becomes thin. Your heart has to pump that much more fluid through your body, which is now effectively larger because you're retaining all this fluid, puts a big strain on your heart. That then also interferes with your blood pressure problems can affect, again, every organ, your brain, your heart, your lungs, your kidneys, every organ. And so those are, kidney health and long-term kidney problems will affect pretty much every organ system eventually.
Yeah, and if you go into kidney failure and you need a kidney transplant, I think one of the biggest misconceptions, because people see stories in the media, is that you can easily get a kidney transplant, and it's not easy. There are not enough kidneys out there for everybody on the transplant list right now.
Yeah, you're absolutely right. So there's good news, bad news with the kidney transplant. The good news is that many are done every year, and the science is pretty well worked out on that. And kidney transplants are, they're common, they're very successful,
yeah.
and they work well. The problem is that we don't have enough kidneys for everyone who needs them. So your point is exactly right. So many people wind up on dialysis for many years, waiting for a kidney that's going to match their blood type and their, and the particulars for their body, so that they don't reject it. And dialysis is, it's difficult. Dialysis is wonderful, but it's also difficult on your body. And so that, again, will have a cumulative sort of impact on your body. So the best bet is to not wind up needing a kidney transplant. The best bet is to maintain good kidney health, good diet. Exercise is great for the kidneys. Moderate the alcohol, moderate the sugar the salt intake, and pay attention and just live a healthy lifestyle.
Yeah, my heart goes out to everybody who's on dialysis right now. But thank you, Dr. Persse, for joining us, because for all of the people who have not yet had to go on dialysis, where their future depends on taking care of their kidneys right now, that's all good information to just prevent it in the first place. Thank you so much, Dr. Persse. We appreciate your time. We're going to take a quick break, and we'll be